या हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in Jayoti Vidyapeeth Women's University, Jaipur. In today's lecture, we are going to start with the hepatobiliary system in the clinical examination. What are the various symptoms, the common hepatobiliary symptoms with which the patient will be coming to you? Or when a patient is coming to you, how will you recognize that the patient belongs to the hepatobiliary disease? So let's start with the hepatobiliary symptoms. The clinical history of the patient who is coming to you with hepatobiliary disease should focus on the symptoms of the liver disease. So you have to focus on the symptoms of liver diseases, their nature, their pattern of onset, how the symptom starts, the progression and the potential risk factors. The presenting symptoms should be analyzed in a chronological manner. As we have discussed earlier, whenever you are recording the symptoms of the patient, the symptoms have to be recorded in a chronological manner. That means the symptoms which are coming first have to be written first, and the symptoms that are coming later on have to be mentioned later on. With regards to the onset, duration of symptoms, the pattern and the progression, the relation to meals or defecation, any known aggravating or relieving factors, and the various other associated symptoms. So you have to write down the symptoms of the patient in a chronological manner in regard to the onset of the symptoms, the duration of symptoms, their pattern and their progression. In relation to the meals, the relationship to the meals we have discussed in the previous lecture of the GI symptoms, or defecation, any known aggravating or the relieving factors and associated symptoms have to be noted down. Now, what are the common symptoms of the hepatobiliary symptoms system for which the patient is coming to you? The non-specific symptoms or the constitutional symptoms of hepatobiliary system includes, it is called the non-specific symptom or the constitutional symptoms because they neither point out the cause nor they are specific to the liver or gallbladder disease. So these are common to many diseases, therefore these are known as the non-specific symptoms because they do not point to any particular disease condition. The non-specific symptoms are fatigue, weakness, nausea, vomiting, poor appetite, malaise and pain abdomen. I will again repeat these symptoms. The non-specific symptoms includes the fatigue, weakness, nausea, vomiting, poor appetite, malaise and pain abdomen. These are the non-specific symptoms as they do not point to any particular disease, but since these are related to the hepatobiliary system, therefore we have mentioned them here. Now we come to the symptoms of the hepatobiliary system, the specific symptoms for which that will direct you to specific disease of a particular liver condition. Therefore, these are known as the liver specific symptoms. These symptoms relate to hepatitis or cirrhosis, portal hypertension and end-stage liver disease. The symptoms includes hematemesis, that is bleeding through upper GI tract, melena, that is blood through the stool, jaundice, that is the yellowish discoloration of the skin, conjunctiva, ascites, that is accumulation of fluid in the body cavities, hepatomegaly, that is increased size of the liver, and edema. These are the specific symptoms that will direct your attention towards the liver disease. These are hematemesis, melena, jaundice, ascites, hepatomegaly, and edema. So this was the symptoms of hepatobiliary system. When you will come to the college, we will again repeat with a practical demonstration how the symptoms you can elicit in a patient. In the next lecture, we will be discussing about the various points that are to be discussed during history taking. So you should always remember that if the above mentioned symptoms are appearing in the patient, then you should direct your attention towards the disease of hepatobiliary system. Now in the next lecture, we will be discussing about the various points that you should keep in your mind while taking the history of the system of the patient with hepatobiliary disease. This session is powered by digital version 2.0 Jayoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.